You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to the program. Joining me now is Kristi Putnam. She's the new Secretary of the Department of Human Services. Good to see you.
Good to see you.
And Janet Mann. She's the Deputy Secretary of the Department of Human Services and the State Medicaid Director. Did I get that?
Yes,
yeah?
That's correct.
I'm going to wave to you because I can't reach across you that far to shake your hand, but we'll do it afterwards there. So thank you both for being here. Appreciate you very much. So. All right, let's talk Medicaid. There's a lot happening. There's always a lot happening in Medicaid. I have to tell a lot of people when I speak to groups that they just think state government's all education and locking people up. I'm like, Medicaid and Department of Human Services is a huge part of all of this. So let's start with the redetermination, the disenrollment process that's going on right now. You've got kind of about a month under your belt so far. You've got, I think you guys announced a little over 72,000 have been disenrolled. The primary reason is because people aren't filling out their forms for what's going on. So maybe explain that process.
Sure, and I think that that in and of itself is a little bit misleading. We are redetermining people their eligibility, and so there are a number of individuals who were kept on Medicaid during the public health emergency, continuous coverage, who are no longer eligible. And if you know you're not eligible anymore, some folks know they're working, their income has increased, they're not going to bother to fill out the renewal form.
Yeah. Janet?
No, I was just going to add, we actually had a couple of thousand individuals that were no longer eligible and they knew it and they asked to be removed from the rolls. But most of the time, if we cannot match them administratively using data sources, we send out information, and if they know they're not eligible, then they don't respond.
There are a lot of places where people will go, though. So like you indicated, some may not qualify anymore. Their work may be their health insurance. They may need to move up or down in terms of where some options are. What are some of those options in terms of, and how they get addressed in terms of you steering them or plugging them to the right places?
So when we determine someone ineligible and they have no other category of eligibility on Medicaid in addition to the category they're in, we will send their information to the marketplace, to the federal marketplace, to look for additional coverage. And that can cover someone up to 400% of the federal poverty level. And then there's always employer-sponsored or self-insured programs.
Some critics will say that when people will fall through the cracks that, we should slow down. I think there was a group of about 23 as part of some sort of healthcare coalition that want some sort of pause for redetermination. But I get the sense that you guys have a system in place and that these numbers that we're seeing are really due to the fact that, over the course of the pandemic, we added a lot of people with just no questions asked.
We did. Well, we added people who were eligible. We retained them in coverage. We added approximately 230,000 individuals over the course of the public health emergency. The organizations, the 23 organizations who wrote the letter asking us to slow down, we have met, and I say we, there were a lot of people working on this before I joined in January. About 14 months ago, in last April, people started outreach, but there have been outreach sessions with representatives who are affiliated with some of these organizations. We would have been glad to speak with the national organizations, but we didn't have any outreach directly from them, but hopefully we can address some of their concerns. There's been extensive activity, and I'll let Janet speak to just some of the specifics on helping redetermination individuals.
Yeah.
So the team has spent the past year doing outreach either through meetings, online, paid advertising, communicating with different providers. We even put digital bulletin boards in the doctor's offices. We've met with each major provider type to let them know that this is going to be occurring and how can we help you get that message out. And so over that time, anyone that's asked for a meeting, we've met with them. We've even reached out to community action agencies and other advocates to meet with them also. Doctors'
visits and hospital stays are where you're really is really where it's going to become aware for people, because that's where you get asked what's your insurance, that's what happens. Speak to me a little bit too philosophically about the fact that if we don't kind of keep these roles clean with the people that truly need it, Medicaid will not be there. This is my 30th year in politics. 30 years ago, we were dealing with the soft drink tax, shore up the Medicaid trust fund in Arkansas, and it's a matter of sustainability to make sure that you've got the right people in the Medicaid program.
It absolutely is. You know, the more individuals we have who continue on benefits for Medicaid, who are not eligible, it takes away resources for those individuals who truly need it. You know, we're talking about our aged population, our blind and disabled individuals, our pregnant women, our low-income children. Those are all individuals for whom Medicaid is intended. And so moving people out of these benefits, if they no longer qualify, frees up those additional resources to continue to provide for those the eligible recipients.
Y'all are working on a waiver request with, is it an 1115 waiver request?
It is. It's a waiver amendment.
So good with all my numbers on all of this stuff. It's just because
impressive.
we've been
There are
through
a
them
lot
a
of
few
numbers.
times there before. What is the status? The public comment period is about to wind down a few days from where we're actually talking right now. Then you'll submit it to the federal government. Is that correct?
It is.
correct.
We will. Our plans are to submit on June 1st. So public comment will end on Tuesday, the 23rd of May, and then we will take in those public comments, and we will respond to those, and that is packaged up with the waiver amendment and goes to CMS for review. And then we will start conversations with CMS on their question and answers on the waiver, the financial piece, and the overall program.
Yeah, it's different this time around in that because this has been tried before in Arkansas. It was struck down by the courts, then I think it was eliminated when the transfer in the presidential administrations came. If you don't participate in the work requirement or volunteering or going back to school, you don't lose your health insurance. You just get moved to a different health insurance is what if I just boiled it all down, that's what you're
That's an
proposing.
excellent summary of it. You do not lose benefits. Those individuals who are in the qualified health plans who have access to some enhanced benefits through the QHPs would move from the QHP over to fee-for-service instead.
Do you think that anything in the public comment period, because you've had a couple of public meetings as well where I think people have been allowed to speak, has anything kind of changed or influenced how you're going to structure this waiver request?
I don't think so.
We haven't seen anything in the public meetings. We have not read all of the public comments yet.
Right.
That will be next week's job is to get through those. So I don't know that we will have anything that will change the structure, but it might change the implementation or going live. We just don't know yet.
I know how these things work a little bit too, so just tell me, peel back the curtain just a tad. You do have conversations with the feds throughout this process. What has been have they been lukewarm to this possibility? Have they been encouraging of this? Have they not given you any indication at all?
Well, I really don't think we've had more than preliminary conversations about we are going to submit this waiver amendment. I think some of the policies, though, that you've seen, there have been some additional expansion of social determinant and support services allowed in other public benefit programs at the federal level. And so it feels like there is more willingness to engage and to help people connect to resources to advance economic stability and mobility. And that's exactly what we're trying to do with Opportunities for Success.
Tell me a little bit about, you've got a big kind of review of the Medicaid program underway from some outside consultants. What are expectations for what's going to come out of this?
Well, I'll open, and then this is Janet's Janet's favorite subject. But really, when I was asked, when I was joining the administration, I was asked, what are your thoughts on Medicaid? It's complicated, it's complex, it's been layered over the course of many years. There have been different pieces added to programs to band-aid some different supports together. This puts everything on the table and allows us to completely review and look at both sustainability but also effectiveness to support the individuals who receive our services.
She said it perfectly. With long-term sustainability of the Medicaid program, right now we're looking at what do we have. We have over 30 programs in Medicaid that serve children, serve adults, serve aged, blind, and disabled. So we really would like a baseline of everything that is currently being offered. Then we can address how it's being delivered and how it's being measured. And so then we can take a long-term view, 4 to 8 years, 10 years at the most, probably due to technology and changing in the populations, to see what Medicaid can do. And so it will take a little bit of time.
Sure.
And trying to just assess the current state is what I call it, is exactly what are we doing.
Yeah. Philosophically, I mean, do you think that you guys will come into that with an approach of we support fee-for-services, we support managed care, we support this premium assistance model? What is there something driving that?
So,
Go ahead.
Philosophically, we're going to say the same thing because we usually do. Philosophically, our approach has been everything is on the table, nothing is off the table.
Okay.
So we want to objectively look at every possibility for Medicaid sustainability and excellence in delivery of service.
it's the same thing. It's looking at it all. And fee-for-service, managed care, a QHP, they all have a place in delivery of health care, but what is the best way to deliver that care is the question for all beneficiaries in Medicaid. So we don't have a set answer or any preconceived ideas. I've met with several different provider groups that are wanting to know what to do, what can we do, and we are, trying to assess the current state, look at everything, and we're going to welcome their input into that area of how they want to do it.
I got about a minute left, so let me ask one last question here. Will raising Medicaid rates for Arkansas hospitals be something that's looked at in this process? I don't think they've been raised in over 10 years. You know the struggles of some rural hospitals across the state of Arkansas. Is that going to be something that's in the conversation?
As part of Medicaid sustainability, we are focusing on hospitals as sort of a separate look. And one of the things I do want to mention and make sure we get in is the governor and the legislature and all of our stakeholders are very focused on prevention too. So that's going to be a theme that you can expect to see is how do we shift our approach in Medicaid to a more prevention-based model. But anything on the hospitals or?
Hospital rates will be looked at. We do have a sustainability hospital study that was done prior to us taking office, Governor taking office and us taking these jobs. That will be a piece of it, but it will not be the only piece. We're going to look at quality of care and what types of services are being offered.
All right, I got to wrap it up there. I'm going to save when are we having a Medicaid special session for my next interview with the governor, so not y'all, won't put you on the spot on that. Kristi and Janet, thank you both very much for being here. Very much appreciate you.
Thank you for the time. We appreciate it.
Thank you for having us.
More to come after this.